Thank you so much. It's really exciting to be here. This might be my peak of the week. And I have to say, Jason and Brenda are both very persuasive. So when someone asks, you're like, sure, absolutely. My name is Alia Stevenson. I am the Chief Programs Officer with the Foundation for Black Women's Wellness. I know some of you, many of you may have heard from Lisa Payton-Kerr, our founder and CEO, in a previous presentation about the foundation. So I'm hoping today, although I do have slides, I do want to share some really important information. I see everybody is very Zoom comfy and able to use the chat very well. So let's make this a conversation. If there's a question, if there's a snaps, I come from a call and a response culture. So if something's resonating, a snap or like a yep, and most importantly, as I'm trying to get to know each of you and the organizations that you represent, let's be thinking about synergies in our work, synergies in the work that we're doing for DMI as well. That's what I really hope to walk away with today. So I'm going to share my slide. We had no problems in our practice round. Are y'all seeing the right screen?
Yes. Yes.
Lost you guys. Hold on. Let me see if I can find you. Well, I don't see you, so I'm going to be just talking at a screen.
No problem. I can.
Which is fine. So flag me in the chat. I do see the chat, but I don't see the screen. So I'll get started and then you guys just jump in because I won't see any hands or any snaps, unfortunately. So a little bit about the foundation. The foundation is a growing nonprofit organization that's based right here in Dane County, Wisconsin, in our capital, Madison. And we exist for a very simple purpose: to empower a generation of well Black women. As you can see from the photo, we are multi-generational in our work, touching Black women and girls and our family systems across the lifespan. This work for everyone at the Foundation for Black Women's Wellness, to borrow from bell hooks, is both personal and political. So we are the women and the families we are fighting for. This is my family that you see on the screen here. These are my mothers, my husband, my brother, and my 5 children. This work started for me 17 years ago when my heart failed at the age of 26 in my 3rd pregnancy. My journey began that day to understand what happened to me, how all the warning signs were missed throughout all my appointments with doctors, and then really uncovering my family's history and really their current day reality of battling heart disease. And then again, my community's battle with heart disease. So when Brenda was talking about our story, my story and my journey with the Foundation for Black Women's Wellness began years ago. It began with sharing my story of heart failure at our Wear Red Day in February. And then I became a board member, and now I'm an employee. So what I learned when I really began to dig deep and ask questions is that what I was experiencing really was a personal example of a larger community crisis. It was shocking for me to learn that half of Black women, so 1 out of 2 Black women in their 20s, have heart disease. Most of us unaware of the signs and symptoms. I had no idea what was happening to my body. I thought I was just pregnant and getting fat. And I did not know that it was killing me. And many in our community don't know that it's killing them at unacceptable numbers. So again, half of Black women in their 20s. And the question came for me, why isn't this information being shared more widely? So that is the story of how this work began for me. And it's not so different for how the work began for Lisa, who you all heard from, the founder and the CEO of the foundation. For Lisa, this work started in Richmond, Virginia, where she was born and raised. That beautiful woman you see in the picture, that's her mom, Roberta Payton, who died May 22nd in 2026 of congestive heart failure at the age of 64. And all those beautiful women that are surrounding Lisa's mother, Roberta, are her maternal and paternal aunts. And Lisa, like myself, began to really map the picture of their short lives and deaths, and was really devastated about what she was uncovering as well. A far too common story of Black women dying too soon from largely preventable illnesses and diseases. So I'm just going to show this short video where we hear about Lisa's story and the birth and work of the Foundation for Black Women's Wellness.
My name is Lisa Payton, and I'm the founder and president of the Foundation for Black Women's Wellness. My mom, Roberta Payton, was a beautiful person. We suffered a great loss
on May 22nd, 2006, when she died at the age of 64 from congestive heart failure. Months after she passed away, I was chronicling all the women in my life who I loved and who I grew up with in my mother's hair salon. Women who knew me from a baby, whose children I knew, and I watched them slowly over time pass away from mostly preventable illnesses. They were in their 40s, in their 50s, in their 60s, like my mom. And it changed me, but it also motivated me and pushed me to want to do something about it. Here in Dane County, Black women's average age of death is 60 years old. That's in comparison to 85 years old for our counterparts. That really struck me when I saw those numbers. And so seeing that in data added an extra layer of alarm for me, understanding that we had to be serious right now in this time. My heart led me to launch Black Women's Wellness Day, which is a full day event where we bring Black women together to really confront the issue of our health. In that room that day, we all understood that we had a common mission and a common goal to really change the conversation around Black women's health, and we could not do that in one day. And the Foundation for Black Women's Wellness was born. In launching the Foundation for Black Women's Wellness, our mission was very clear. First and foremost, our aim is to empower Black women to live their healthiest and most well lives through education, awareness building, prevention education, and really engaging and involving them in a process of being well and being healthy. Each year we reach and touch directly over 2,000 women. All that we had created, all of the education programming, all of our awareness building events, the gamut of what we do, it needed a roof. We decided that it was time to open Dane County's first Black Women's Health and Wellness Center. We're looking so forward to opening the center in the next few months. Once the doors open, we will be able to offer all of those things in-house, our wellness classes, our nutrition classes, prevention education, breast cancer education, heart disease prevention education, supporting folks in understanding how to overcome health conditions. There's really no limit to what we can do.
Thanks for muting me. Sorry, I didn't even think about that. Really no limit to what we can do. That video was taken as part of our GoFundMe campaign. And at the end of 2019, we opened the doors to the first ever Black Women's Wellness Center, which is beautiful. If you haven't visited, I hope that you'll take me up on an offer to visit. But it was opened in January of 2020, and then we know what happened in March with the global pandemic. We had to close our doors. And so that is the truth of that. But as you heard from that story, my story and Lisa's story, the work of the foundation is really, really crucial in our state. You know, Black women's health is and has been in a state of emergency for far too long. We know the statistics by now. Wisconsin leads the nation in health disparities for Black women who are overrepresented in all major categories of disease and illness, and who are more likely, as we heard in the film, than our peers to live with and die from treatable and preventable illnesses, and at younger ages. We also know there's a unique disparity happening in Wisconsin, where Black women in Wisconsin face a widening life expectancy gap, making us the only state in the nation where this trend is emerging. And again, the average age of death is unacceptable. At the time of that recording was 60. I believe 2 years later was 62, and none of us really know the impact yet of the pandemic. We also know that Wisconsin leads the nation in birth disparities, with Black babies 3 times more likely to die before age 1 than white babies, and where Black women experience worse maternal outcomes than our white peers, illustrated by a 5 times greater maternal mortality rate. We also know that Wisconsin leads the nation in racial inequality, with documented inequalities in all the things: employment, education, housing, wealth, justice. And as you can see from the county health rankings model right there, this is not a failure of Black women and families. 40% of what contributes to our health are social and economic factors, such as employment and income. And of course, we know what is exacerbating this pre-existing public health crisis is, as we're living through it, the COVID-19 pandemic, and its disproportionate impact on an already vulnerable community, the Black community. I wanted to share that data, and that's something that we share quite often. But recently, as I was wrapping up a grant report for some COVID-19 funding that we received, I think it's really important to put a face, put a story, put a human to that data. And these are 2 snapshots that I want to share with you today about when we talk about the women that we're serving, when we're talking about the crisis, when we're talking about the structural barriers that we're trying to overcome. And then as I transition into why the foundation does the work that it does, this diverse body of holistic work, this is why, and you'll understand. Obviously I've used initials to hide identity, but HP is the mother of 3 boys, 2 in elementary school, 1 in middle school, and was pregnant with another on the way. She just left a domestic abuse situation, her ex-husband stalking her. She's not receiving child support. He removed money from all her accounts, and she's been living at a hotel waiting to get approved for a rental assistance program. She had a place to stay, but didn't feel it was safe. She mentioned there were sex workers and drug abusers in and out of the area, and she wasn't being provided meals promised by a program in our community to provide meals. Due to the lack of transportation, she also missed all of the summer giveaways for backpacks and clothing, and her kids ended up missing the first week of school because they tested positive for COVID-19. So that's one example of the crisis that we're experiencing with women. The other example, DB, working at an organization who wasn't in compliance with sending information necessary for her to receive her unemployment. She stopped working there because they weren't providing adequate PPE, which is critical for her because of asthma, high blood pressure, and severe anxiety. She was 3 months behind on unemployment, single mom of 3 boys. At the time she reached out to us, she currently had 3 days worth of food, no transportation, just lost her grandfather and her dad a year ago, no family in Madison. Again, moved to Madison because of a domestic abuse situation, behind on her bills, without the resources for basic living, including tissue, washing detergent, and clothes. So I wanted to share those things because when we're painting a picture of the women that we serve, this is the intersection of the crisis. So obviously at the foundation, we work to provide the very immediate things, but also we work to transform the systems that set Black women up in these situations in the beginning. So here's our mission, and it is quite powerful when you think about the women that we're serving, and that is to energize, mobilize, and support Black women to transform their lives, transform their own lives. I want to say that again, through education, advocacy, and powerful partnerships. We are not a social services organization. We do this work very quietly, but our goal is not to just hand somebody something, but really to help them transform their own life. And that's where our theory of change comes in. And this is how our work, our body of work is constructed around this foundation. We know that in order to change this narrative, to change the lives of these women, that our solutions must be systemic, must focus on root causes and the social determinants of health, as we saw from the county health rankings as the largest driver of health. And we must prioritize at the center Black women as the most qualified leaders of health equity work in their community. We must equip them with their capacity to lead and shape and influence their immediate environment. And then we must connect them to systems and to decision makers to co-create and sustain change. So when you look at the body of the work that the foundation does, you'll see education, leadership and organizing, health literacy, personal and family wellness, partnerships. Again, we rely on folks, many of you in the room. I saw on the meeting agenda, I saw MG&E at the bottom, and I said to myself, that's one of our partners. It's been one of our partners since the very beginning. So we rely on our partnerships in order to change this narrative, and funders. And then we rely on advocacy. So really sharing the story, helping shift the policies and practices that are making Black women and families' lives more difficult in our city and our state. So this is what it looks like. I'm really proud of this work alongside of our theory of change. So we have strong partnerships. I cannot stand that picture there. My hair is awful, but there we are with Governor Evers, helping think about what policies need to happen in order to change the way things are going. And if you look on here, we also have the university as one of our closest partners as well. And we have our partners across the health systems as we're deeply engaged in shaping health equity efforts and policy imperatives. This is something we're really proud of, and that is our Saving Our Babies work. We partner with the Dane County Health Council, which is comprised of the 4 major hospital systems, governmental public health, United Way, MMSD. We deeply listen to community to inform low birth weight and infant mortality crisis. We published a report to advocate for investments in Black and maternal and child health. We recently launched Dane County's first ever Black Maternal and Child Health Alliance, which I am proud to be a co-chair. It's 22 Black women who represent doulas, peer support specialists, academicians, public health experts, community-based organizations, in order to connect community priorities with the work of these organizations and to monitor and inform the Health Council's efforts. And again, this work is so powerful because we are the women that we're serving. So these are women who are mothers, women who have lost babies, women who experienced traumatic birth. Again, centering, as our theory of change shows, Black women in all that we do. And in just a few months, we're going to be launching a very exciting care coordination system that will screen pregnant women for the social determinants of health and connect them with community resources, including doulas, community health workers, to ensure healthy mothers and healthy babies. Very exciting work. We're really proud, that our national relationships are growing. We're trying to bring attention and resources to Wisconsin to support this change. And we're really proud of our recent success alongside the Dane County Health Council in winning the $1 million prize from Schmidt Futures and Dream Up. Yes, Brenda, thank you. Very proud of that. We are also educating. This picture makes me so happy and so sad. This was 2019. This is Black Women's Wellness Day. If anybody hasn't been, this was like I know Brenda, you were at every single one of these, but this is the ultimate family reunion. And it's also a great illustration of what it looks like to bring together systems partners and Black women around a table in order to really think about information, inspiration, and tangible actions to co-create those together. We also are raising Black women's wellness from a whisper to a movement. Super proud of the foundation featured here in a special report by the prestigious Mayo Clinic on health, racial health disparities. So again, trying to inform not only our local community in Wisconsin, but beyond about the work that's happening in our local community. And then we're also researching and publishing as well. Super proud to be featured in the Wisconsin Medical Journal, co-authored by myself and Lisa, elevating the voices of Black women who were not listened to or believed by medical professionals, and the resulting care not received, the pain that they endured, and in some cases, being close to losing their lives. This is happening in just 2 weeks. We are launching the Well Black Woman Institute, which is Wisconsin's training ground to equip Black women. I call it the Little Lisas, but equip Black women as health equity leaders, starting in Dane, Milwaukee, and Rock counties, where the need is greatest. And we'll be launching that. We have a cohort of 16 women, and we will be training a cohort every year. One thing we know to be true is that we can't do this work alone, and we have to shape coalitions across the state around this work to really move the needle. And I'm really excited about DMI's policy advocacy work, because we are also launching a policy blueprint for Black women's wellness in Wisconsin. Currently, there is no roadmap identifying what Black women need to be well. Last year at Black Women's Wellness Day in September, we launched Black Women Deserve, which is our preamble to our policy blueprint. That was really baked in these 9 pillars: economic security, safe and affordable healthcare, equal rights, equal justice, safe and healthy communities, environmental justice, quality education, equal opportunity, and freedom. And looking at the advocacy efforts of DMI, right in line, excited about how we can work together to advance these efforts. And again, our vision is a world where Black women are healthy, thriving, and free. Now, we know we're not there yet. We saw the data. The data is showing that we have a lot to do. In 2018, when we did the Saving Our Babies report, these findings were drawn to the top from the feedback of over 300 Black women, youth, and men and youth, and service providers who we asked to help us identify the root causes of these persistent health and birth disparities. And the findings that you see are summarized in these 10 broad themes listed on the screen. But our community told us that the biggest risks to their health and well-being are stressed Black family systems, a generational struggle for economic stability, and systemic racism and its effect on every facet of their daily lives. If you bear with me, and if I have time, which someone's going to have to write in here if I have time or not, I would just love to, we partnered with the Local Voices Network in order to capture, we have all the time, plenty of time. Okay, great. We captured, we did some deep listening to Black women across the state. And we asked them to describe their barriers to their wellness and their vision for what it means to be a well Black woman in Wisconsin. And I just want to play a couple of examples for this group here. Let's try that again.
I think for me, the barriers that I have, it's just being a Black woman. I think just being a Black woman is the barrier that I have. Because I feel like as I walk through the world, like people don't listen to me as a Black woman. Whether it's the job place or the doctor's office or just in the world, I feel like I constantly have to advocate for myself. Granted, there are great people in the world too. You see some great people sometimes, but the likelihood of being in contact or finding these great people are really low compared to all the barriers that I face daily as a Black woman. And it's just exhausting. I would say it's really exhausting, not being listened to or constantly having to prove your points, fighting for things that you shouldn't be fighting for. Mm-hmm. It's just really exhausting. I think being a Black woman is the the real barrier that I have. Because sometimes I feel like if I was not if I was not Black or if I was not a woman, there are things that would have come easily, to me, or I could have navigated this world. Like things would have been easier. But those, being a woman and then being Black, adapt. I think for me, the barriers.
All right, we're going to listen to two more voices quickly.
It just means that we are allowed to be free, and this environment is an environment of inclusion and not assimilation. We're not expected to adapt and adjust in order to fit these cultural norms. Like, it's okay to just be a Black woman and bring our complete authentic selves to the table without somebody questioning who we are and our credentials. It just means that we
I feel like Black folks still aren't free in this country. So and ultimately a well, healthy Black community, we could be free to live our life without feeling constricted, right? We could breathe. We don't have to constrict going one space to another. That would be huge. Like if I want to go out in nature just to walk, I don't have to be scared because of white folks looking at me in a certain kind of way. I don't want to have to be scared to go into rural Wisconsin where I like to go. That freedom to actually be healthy and have that opportunity
to be healthy. So I think this is really important, and their language and words are important for every audience, of course, but really important for this audience in particular as we think about what does inclusivity look like? What does it mean to be an inclusive organization? What does it look like to shape an inclusive Madison, an inclusive downtown? These are the voices of people who realize that, and we talked about this in the last presentation for DMI around the lakes, is like not everybody even feels included to be in green space and nature, to be included as they are in organizations that serve folks downtown or employ folks downtown. And these are the things that we're trying to shift. So this video that I'm going to play next is, it was a fun event. As we were constructing Black Women Deserve, our policy preamble, we brought women into the wellness center, and we were just having a good time envisioning and being in a place of joy and really claiming what it is that we deserve. And so I just want to play this for you.
Black women deserve to feel protected.
Black women deserve equal rights and equal pay.
Black women deserve safe and nurturing communities.
Black women deserve love, peace, joy, quality health care, self-care, and well-being.
Black women deserve rest, peace of mind, and respect.
Black women deserve to live healthy, thriving, and free, to live long and healthy lives full of beauty and joy, and free of disease and illness and racism. Black women deserve to realize our full potential in a world that respects our humanity and where our children and our families can grow and prosper.
Black women deserve to embrace their identities and express themselves freely without being judged for not fitting a stereotype.
Black women deserve health equity, quality education, to be heard, peace, and respect.
Black women deserve respect, trust, justice, the right to self-care, and the right to live the best life.
Black women deserve not to die from childbirth.
Black women deserve safe spaces to be who we are.
Black women deserve healthcare providers that listen to and believe them. Black women deserve schools that believe in the excellence of our children. Black women deserve affordable housing in communities with access to green space.
Black women deserve not to be the superhero.
Black women deserve not just health, but flourishing health, safety, wellness, freedom, and joy.
Well, Black women deserve unbiased community partnerships. Well, Black women also deserve loyalty, dignity, and partnerships in a community that reflects our healthcare that matters.
Black women deserve the time and the energy to indulge in self-care without interruption. An abundance of both tangible and intangible luxury. Black women deserve access to the resources that give us the autonomy to create the lives that we want for ourselves. We as Black women deserve simple and eternal bliss.
Black women deserve everything, but more importantly, Black women deserve quality education, access to quality health care, equitable income, and communities that support them.
Black women deserve good health, peace, prosperity, and happiness.
So when we begin to talk about Black women deserve, we first have to start with us as a person, as self-care. So I deserve the fullness of what God has for me. That means health, wealth, strength, everything that He has for me. And when I get that, then I can bring that on to my community to say Black women deserve in our community health, equity, strength, education, housing, all those things that make us already great, but then we put in that Black excellence because we are Black women deserve.
Black women deserve. I hope that gave you as much joy in watching as it did in creating it. So when we look at the women that were represented there, I am quite sure that many of you recognize those women. In particular, Brenda, I know that we're talking about the outstanding Women of Color Awards that are happening, and Miss Carla Gaines, a board member at the Foundation for Black Women's Wellness, is one of those awardees, so we're incredibly proud. I wanted to share this from our beloved ancestor, June Jordan, and really the conversation that we're having today and the work that this body is doing as the Inclusivity Committee, as DMI. They bonded together against what's wrong as a collective, because the collective is the beginning and the point. And I hope that you carry that with you and really start to think, what does that mean for us as we work together to undo, to really have Madison be what it can be for everybody. I do have some reflection questions if we don't have things to talk about, but I can't imagine that we won't. I'm going to stop sharing my screen right now so I can actually see people. There you are. I don't know where you guys went during that quick presentation. I know I tried to give you a sense of who I am, why I got involved in the work, who the foundation is, very briefly, a snapshot of the work that we do on the individual and policy and systems level to change things, but really would love any questions or comments or intersections or thoughts that came up from that presentation.
I have a question.
Yeah.
This is Jason Belaungi. My question is, what work is the foundation engaging in around long-term care, which has a lot of connection, obviously, to healthcare, wellness, but for folks who need services and support, especially community-based opportunities? I'm just curious if there's a connection in any of that work as well around long-term care.
Not directly, other than advocating. One of the things that we're really proud, some programming that came out of, I should have told the whole genesis story of the foundation. Many of you may know this, but Lisa started 13 years ago this conversation as Black Women's Wellness Day, as one day out of the year to be centering Black women's health and wellness. She did that in Richmond, and then when Kaleem, came back to his hometown, Madison, she came with him and brought that day with her. it was here where Black women, well, number one, she was shocked by the disparities in this beautiful city that we live in. We're surrounded by these lakes and surrounded by all this opportunity, university, access to quality healthcare. And the Black women of Madison and Wisconsin said, we can't just have a day. We need to be focused on this emergency year round. And so Lisa at that point launched in 2012. So we're 10 years old this year. It's our 10-year anniversary. Launched the Foundation for Black Women's Wellness. Mind you, she was still, working with 5 kids, and this organization was in her free time as her passion and love letter to the life and unfortunate death of her mother. And so it wasn't until 2 years ago in February where Lisa added, well, 3 years ago, she's like, I'm going to do this full time. And then 2 years ago, she added her first employee. So the foundation, although it was birthed 10 years ago as a 501c3 nonprofit, just added its first employee other than Lisa 2 years ago. April will be my 2 year. And then we have been ramping up with, now we've hired Gabe Doyle as our Director of Community Health Initiatives. We've hired 3 community health workers. We just hired Christine Russell as a Director of Health and Wellness. We're ramping up. So I want to say all that to say, our strategic vision for this work is broad and wide, and we haven't been able to reach it yet. That being said, on our radar is the full array of life, literally pre-birth to death for Black women and families. And so that is for sure on our radar. And we host on Wednesdays a morning coffee series where we have centered that conversation and really the level of care and the level and the caregivers involved. And so my answer to you is that we look forward to having more conversations around that. Because that's critical in our community right now, and we are just being born is the true story. But thank you.
Great, thank you.
Thank you, Jason. Important question. Any other questions, comments?
Opportunities, anything that resonated?
I have a question. I mean, how you and I have this conversation all the time, but I think it's good for membership. How can DMI help? What can we do as members, as an organization? What can we do to help?
I see so many synergies. Again, we have so many exciting partnerships. We're partnering right now with UW Core and Columbia University to really build out a data book and some policy. We're partnering with Madison Parks right now to think about how we can use, that space for our wellness programming. Partnerships, there's so many opportunities for where our work can co-inform, overlap, and support one another. We've been excited to be able to talk about our organization at WPS. We've been excited to talk about our organization at A Grace. I was able to go back to A Grace. So the opportunities to open doors, to partnerships, to find alignment. We've talked, Jason, about, again, just the advocacy on some of these things, like what is BRT going to do in our city, and how can we be at the table around that? What does it look like, the development, along John Nolan, and what is the impact of that? When Peter, when you were talking about this beautiful walk that I've never been on before, so I will be signing up. Not the 50-mile thing. I don't know what that. I don't think that's a wellness, but the 2 mile, yeah, I can do that. And potentially, we have our Capitol walkers that walk every Wednesday around the Capitol. Maybe that could be our walk that week. So we'd love to be able to promote that walk and find that synergy there as well. But when I think about that, what does development look like in impacting these historically Black neighborhoods? I think the conversations and the opportunities, in particular, the DMI is made up of the top employers in the city of Madison. And if folks pay attention to where health comes from, it comes from employment. It comes from wealth, right? And it comes from policies, like, FMLA and other things that support us, access to insurance, et cetera. So I think when everybody starts to understand their role in transforming our community, because I think oftentimes when you say Foundation for Black Women's Wellness, they're like, oh, well, you work with the hospital systems, right? And we're like, yeah, they get it. They get how they're tied to health. But how do the rest of us as an organization, thinking about the internships that we've been talking about for DMI, how does that change the trajectory of Black families and provide, family sustaining wages down the road, and that experience and that social networking that's so critical. So I would just offer up my contact information for anybody who's wrestling with like, oh, that vibed with me, and I'm not sure I would do this work over here, and I'm not sure if we have any intersections. I would welcome that conversation, because we definitely have intersections.
Oh, completely agree. Thank you, Jason. And completely agree. I mean, I think that the more we think about this, the more it will make sense, or is making sense for us in the Inclusiveness Committee in DMI to really learn about the history or about the particular communities, centering them, and then how do we move forward and how can we support DMI for sure, but then each committee can really have this conversation as we are having the conversations through the challenge committee, that we can continue to have this connecting the dots, as I call it, right? That hopefully is the benefit of having this type of presentations and conversations at the end of the day, right? The fact that you in the community feels healthier, that more that will have that connection with downtown Madison or any other industry, right? Yes. How do we make it more diverse and more welcoming is when we really learn about communities and we know and we are supporting that wellness for that community. So I'm excited. Other comments resonate, if this resonates with you, with maybe you are part of other committees, that maybe we can think of how do we bring that conversation. Anything else?
Well, we're signing up July 9th. For sure.
That's the date? Oh, good. Well, I mean, I just want to say from DMI's perspective, a huge thank you. I know Brenda is the chair, but from us at DMI, thank you. We can't wait to
absolutely
partnerships, get the message out. We've got this recorded. We're going to get it out, get it to everyone that couldn't make it here today. This is such an important message. So we are just so thankful that you're partnering with us, being on our board, what you're doing for the community, your energy, your drive, your creativity, your leadership. We are all very thankful. So
thank you. Thank you guys for being really patient with my kids coming in and me pointing at the door like, really? Out of all the times? And my 7-year-old grabbing my 5-year-old. It was quite the display that you guys didn't get to see this part of it, but there was a whole thing going on right there.
Lots of parents on this call that have dealt with the same situation.
Absolutely. That is the connection. So thank you very much. I'm sorry, Jason, again, I know that you're part of we wanted to have a report from the Beyond Compliance Committee. So I just want to make sure that, we'll have more opportunities to do that. Maybe, or we have 2 minutes. Maybe there's a highlight that you want to share?
I'll just do a real quick one. July 26th is going to be the date for our Accessible Design Forum. So bringing together people with disabilities, designers and architects to how can we improve accessibility and inclusion of people with disabilities, all ages, all identities in design and architecture and building. So more to come.
Great. Thank you so much. And we'll have the opportunity to also, Ron is not here in the meeting, and a few others that apologize for not able to attend, but we'll have the opportunity to have this conversation and to maybe have an update about the subcommittee with the internship initiative and also the DEI toolkit and also the book club. It's going so well. And maybe anything you want to share, Jason, about the book club?
Absolutely. So 2 quick announcements. If you want to join us, the book club, we're setting the date. Got a doodle poll out now. We're reading Deep Diversity by Shakil Chowdhury. That is our next book. We just finished the amazing This Land podcast. Peter, Brenda's on this just life-changing podcast. Thanks to Missy Tracy and the whole team. And then the other, I just want to give an update on the Latino Professionals Association Connexionis event, which we've been running for several years now. It's a mentorship program. We started last week with our first. Heather was there. I was unfortunately out of town last minute, but we were there, had a great visit. We had several DMI board members there. Love working with LPA. We've got 2 more scheduled for, I can't remember the exact dates, but in April and May at the end of the month with our friends at the Concourse Hotel. It's a great program on mentorship going both directions. So we're excited to continue that event moving.
Thank you. Well, I have my energy back. Thank you, Alia. This was great. Thank you for the conversation, and I'm sure that we'll ask for more in the future. So I really appreciate the conversation. And many of you, if you have other ideas, please let me know. We'll close. It's 5 o'clock. Our next meeting is April 7th, and we have already an agenda in collaboration with the Transportation Committee.
Yes, we're working through that now. I don't know that we have the date yet for that. So we're working through to have a collaboration with the Transportation Committee, a big issue that Alia just talked about, and how, you know, these are all intersected together, and they have to be. And we're going to bring that up. And Peter and several people, Doug, who was on earlier, a big part of the Transportation Committee. So
perfect. Thank you. We'll see you soon.
Thank you. Bye, everyone. Thanks, Brenda.